it's Millie, I hope you're well. I want to talk through a little bit about core strength and why you need very good core strength as you go into your midlife and beyond. So first of all, the core comprises of our diaphragm here, the main muscle in charge of breathing. Also the abdominal wall all the way around here, coming round to the sides, to some extent the low back, and then importantly the pelvic floor as well. So that makes up your core. So why is that really important as we age? Well, first of all, I want to talk a little bit about pelvic floor dysfunction. So that is when the pelvic floor is not operating properly. So that can lead to things like prolapse, bladder weakness, and various other problems. So prolapse is when one or many of the organs start to move position inside the abdominal cavity, and that can lead to a sort of downwards dragging sensation depending upon what type of prolapse it is, and general feeling of weakness and discomfort in your pelvic floor. It can make bathroom habits really difficult as well, not to mention sexual function as well. So you can get 3 different types of prolapse. You can get a prolapse of the back passage, a prolapse of the vagina, or a prolapse of the bladder. But there's plenty of other information about that another time. Bladder weakness can also be an issue of pelvic floor dysfunction. If the muscles are not firing up properly, then you can experience bladder weakness and stress incontinence, which is where you may find a little bit of urinal leakage with things like coughing lots or sneezing. But that kind of thing, again, is quite easy to avoid unless there's something clinically wrong, just by using strength work. On top of that, there's also vaginal atrophy, which can happen as you age, and that happens during menopause when estrogen levels start dropping, and that is the wastage of tissue around the vagina, and that can cause the skin to become very thin and also very dry, and it can become quite itchy as well, and it is not comfortable. Regular use of your core, involving your pelvic floor, can help to prevent this from happening, along with sensible guidance around HRT, whether that is all-round HRT or topical local HRTs as well, particularly estrogen. As well, coming now back up into the whole of the core, what can really help is with back pain. If you are able to get the front part of your body here to function, the diaphragm, the abdominal wall, the pelvic floor together, guess what? It's going to take lots of work out of your lower back, and it can really, really help to take the pain away from that low back. The 2 muscles here that run between the rib cage and the pelvis, they're very thin and they're very susceptible to fatigue. Guess what? Here we've got this lovely, huge layer of muscle across the whole of the abdominal wall. Learn how to get that to fire up when you move so that you do less with the low back. That also comes into posture as well. So if you've got this working really, really well, it'll give you that more upright posture. And that is something that is particularly important at the moment in our society as we start to do sedentary jobs and the shoulders creep forwards. Having this nice and strong, and as well with the bottom, with the glutes and the abdominal wall love working together. That puts your pelvis back underneath the body and can allow the shoulders to become a little bit more upright. And this is functional. That's the important part. Postnatally, having your core strong is really important as well. Despite whatever delivery method you had, it is still important that you work the abdominal wall, but also the pelvic floor. As your growing baby, moved muscle tissue and other organs, when the baby is then born, with again either vaginally or through a C-section, then those tissues do need a little bit of help and encouragement just to come back together again. And this is where that core work can be absolutely vital. Particularly as well around a C-section scar or around hysterectomy scars, it's really important we get the abdominal wall firing up correctly, because scar tissue and where incisions have cut through multiple layers of connective tissue in the body and through the skin and through muscle fibers particularly, so it's important we get those back on point. After a baby as well, you can get a diastasis, which is a slight gap between the rectus abdominis, which is the 6-pack here along the abdominal wall, that can have drifted apart during pregnancy. It's important that you know it is not the end of the world. Diastasis is perfectly manageable. I have a diastasis, and sometimes if I'm not managing the pressure in my abdominal cavity correctly, I will see that in a little doming shape that comes out through here. So postnatally, working your core can really, really help to manage the pressure inside your abdominal cavity to prevent herniation through the midline, which can happen if this is not strong enough, or if your pelvic floor isn't strong enough, that turns into prolapse. So core strength is absolutely vital for your body. Please feel free to get in touch if you'd like any more information. Thanks for listening. Bye for now.